How is your approach with technology different, perhaps more efficient than what they're offering?
Yeah, sure, that's a great question. So, as you know, there's just a huge shortage of doctors and nurses in the United States, and the way that problem has been traditionally solved is with these staffing agencies, the AMNs of the world. And it's a very cumbersome, very antiquated industry, and Nomad is solving that problem with cutting-edge technology. Essentially, our approach is that we cut out the broker. We replace all their functions with technology, cut out the red tape, cut out the cumbersome processes and the expense, and allow for direct, transparent interaction through our marketplace.
I mean, Uber 4 has become sort of a cliche, but in a sense, are you acting as a dispatcher, working between the hospitals and the doctors, putting the right professional in the right place?
In some sense, we are bringing the gig economy to healthcare. We liken ourselves a little bit more to Airbnb, which is trying to broker a very complex transaction. I mean, you're having someone come into your home, you're having a doctor come into your hospital, and so we help with insurance, background checking, credentialing, payroll, taxes, all sorts of things. And so we take a very complex transaction and make it almost as simple as point-click hire. We've done that for the doctor market, and we're now, just this week, we launched into the nurse market as well.
What's penetration like, and how deep can it get in terms of either professionals or hospitals or both?
Yeah, so I mean, this is a huge problem in the U.S. I mean, there is a shortage of about 100,000 doctors in the U.S., about 1 million nurses in the U.S. Nearly every hospital and clinic in the country uses these kinds of freelance doctors and nurses. So there is a huge opportunity here. It's a multi-billion-dollar market. For us, we're in 14 states for the doctor market, just recently launching in California and Texas. And then this week we launched our nurse market in Texas alone, but over the course of the next year or so, we'll be across the U.S.
What's the incentive for a doctor or nurse to participate? Because I've talked to friends who are in med school who are accumulating a ton of debt, and they say it'd be more lucrative for me to become a dermatologist or a plastic surgeon than to practice general medicine.
Yeah, I mean, there's a lot of reasons why doctors and nurses participate in this kind of work. Two really common categories are, number one, these young doctors coming out of med school or nurses coming out of nursing school. They have a lot of debt, so they want to pay down their debt. They want to start a family, buy a house. Doing this kind of freelance work actually pays a little bit better than doing full-time work as a doctor or nurse. And then the other kind of person who really often likes to do this work are people nearing the end of their career. So they love medicine. They don't want to give it up, but they don't want to practice 60, 70 hours a week. So this flexibility that much of the gig economy allows is very attractive now in the healthcare world.
What's the minimum number of hours they have to work to participate on a weekly basis?
So there really are no minimums, and so there are no actual minimums. Practically, there are minimums. Right now, the system is so cumbersome. There's so much paperwork and kind of brain damage you have to go through to get one of these jobs that usually they want a couple of weeks worth of work. With ours, you could take a job tomorrow for a few hours, and the technology enables that.